We've had remarkable improvements in outcomes for metastatic melanoma in recent years due to immunotherapy and targeted therapies. But there's one remaining challenge, and that is patients with brain metastases. We're frequently now seeing patients with control of disease outside the brain, but difficult to control disease in the brain. So where are we at and where have we come from? Well, traditionally with surgery, with radiosurgery and chemotherapy that was not effective, median survival for patients with brain metastases was less than 5 months. Now, as we're understanding the biology better of brain metastases, things are improving. Firstly, we know that melanoma has the highest rate of brain metastases of any solid tumour. Interestingly, when one looks at the biology of brain metastases in melanoma, there's some very interesting features. Melanoma metastasising into the brain breaks through the blood-brain barrier, so effectively there is no blood-brain barrier for patients with imageable metastases with respect to the drugs that we use. Hence we see response rates to targeted therapies approaching that's seen with extracranial disease. However, they tend not to be as durable. Similarly, the microenvironment of brain metastases is such that immune cells can clearly traffic into metastases in the brain. Indeed, of all solid tumours metastasising to the brain, melanomas have the highest rate of CD8 positive T-cells within the metastases. What does this mean? Well, in fact, it means that immune checkpoint therapies can be effective for brain metastases. So where are we heading and what is the new data now? Well, with combination therapies, so for targeted therapy, BRAF plus MEK therapy, and with immune therapies, particularly the combination of CTLA-4 and anti-PD-1 with ipilimumab and nivolumab are really giving very promising results. Targeted therapies, we're now seeing median survival of approximately 12 months. And the early data is even more promising for the combination of ipilimumab and nivolumab, where median survival seems to be definitely better than 12 months because the early progression-free survival data suggests that the median progression-free survival may be at least 12 months for patients at least that are eligible for clinical trials. So I think we've come a long way. We've moved far beyond the nihilism of less than 5 months overall survival with brain metastases being a death sentence. We now have effective systemic therapies. And going forward to look at the correct sequencing, the combinations of stereotactic radiosurgery with different systemic therapies are key areas where we can hope that our patients will get much better disease control, much better quality of life, and indeed much improved overall survival.